Stroke. There are no new guidelines geared towards the prevention of stroke. This is according to a November 2024 Associated Press article. Now, before I discuss these new guidelines, let's first have a great understanding as it pertains to what stroke is and what are the current guidelines geared towards the prevention of stroke. So, according to Google search, a stroke is a medical emergency that occurs when blood flow to the brain is interrupted, either due to a blockage or a rupture of a blood vessel. This interruption deprives brain cells of oxygen and nutrients, leading to potential brain damage, disability, or death. Stroke was the fourth leading cause of death amongst Americans in 2023. This statistic is also closely linked here in Jamaica, where stroke is also within the top five leading cause of death amongst Jamaicans. Now, in terms of preventing stroke, chiefly what it is that we do know is that lifestyle related factors are a key determinant. These factors include healthy diet, movement. Now, specifically, where it comes to the healthy diet, as per the Associated Press article, eating a Mediterranean diet is still considered as a go to towards preventing or minimizing the risk of getting a stroke. Fruits, vegetables, minimal fats, and basically having relatively good sources of protein with low saturated fats in it, such as from seafood. Similarly, where it comes to movement, having physical activity that ranges from or ranges between 75 to 150 minutes per week is still considered as a significant or critical component, lifestyle component geared towards reducing the risk of stroke. Similar to these lifestyle factors, there is also the recommendation of maintaining or attaining healthy weight ranges. So, reducing obesity is basically considered as another critical factor. Another tool geared towards reducing obesity or managing obesity is the category of GLP-1 medication. So, what are some of these new guidelines? Well, according to the Associated Press article, doctors should now screen their patients for non medical determinants. These can include sex, gender, access to health care, discrimination, racism. As it went on to say, Black Americans have twice as much risk of experiencing stroke, and this has been found as a result of these non medical factors. So, essentially, by screening or doing these screens, the doctors basically can be in a better position to recommend social intervention strategies which can assist the patient towards reducing his or her risk of stroke. Now, this new quote unquote guideline points towards the social intervention or the social angle of health intervention from our medical doctors. But I will say that this is not entirely new because this basically leans towards the social component of health itself and or wellness, and this has been a practice for years. I mean, I can even speak to coming across definitions of health with a social angle as far back as 2013. I guess the reason why it is regarded as new is because it is now so being adopted amongst the gatekeepers of health practitioners in the form of medical physicians. Nevertheless, This is a win, and hopefully it can be critical towards reducing stroke from the current numbers expressed.